Welcome to a new way of writing an OET letter. For this, you need to keep one printed copy of a case notes, which is a question paper of an OET letter. And then you should also have a notebook or a paper and a pencil and an eraser if you have this all. If everything is ready, we can start. If it is not ready, we cannot start. Please pause the video and find these case notes and other things and come back and play the video and let's continue then. Ready? If you are ready, I am also ready. How to write a letter? First of all, let's go to the case notes and find out the first element, that is a date element. On the top of the letter, you will find today's date. Just take that and write it here on the top right left side of the letter. On the paper. You should write that in the expanded format, not the contracted format. They will give you 24/1/2024, but you have to make it like 24th January 2024 or 3rd February 2024. These kinds of starting is required for date. So if the date part is over, we are going to the next one after leaving a single line break. In that one, that is known as the address area. The address area, to find out where the address is, you have to go to the bottom of the case notes, and in the writing task area, you will see the recipient's name and address. So like here, the admitting officer, Eventide Old Age Home, Melbourne, something like that, the address will be there. So you have to write the whole thing. So just below the date part, you have to write the admitting officer, Eventide Residential Aged Care Home, whatever, and then the full address there. In the address area, try to avoid the country name if the letter is going from one place of the same country to another place of the same country. Like letter is going from Melbourne to Sydney in Australia, or Liverpool to London in UK, or from Kerala to Punjab in the case of India. So in such cases, we don't have to write the country name. I hope it is clear to you. So we have written the date on the top, address next, and the next is dear sir, dear madam, or dear sir, madam, dear doctor, dear nurse. According to the recipient, you have to write. So we have written the first three lines. After that, we have the next one, that is RE line. That is the fourth and last of the first part of the letter, RE line. RE stands for referral or reference. In that one, just write RE and a colon, and then write the patient's full name with the salutation and prefixes. Sorry, not salutation, but the prefixes like Mr. Peter Parker. Then give a semicolon and write the age, 25 years, 55 years. If the age is not given directly, write the date of birth, complying with the same format of date on the top. Okay, that is important one. Okay, so please avoid words like aged and old in the date format. In the RE, on the RE line, it should be Mr. Peter Parker, semicolon, 55 years. Don't write old, don't write aged before that. These are unnecessary. All right, if that is clear to you, what we have done was the launching part of the letter is written here. The launching part of the letter. Launching part means the area before the first paragraph of the letter, which will include DADR, date, address, DAD, dear sir, dear madam, salutation, and then finally RE line, DADR. Just remember this. If you have understood the launching part of the letter, we are moving directly to the next part of the letter, that is known as the opening part of the letter. The opening part of the letter can be written using two types of codes. One is PRPDD and the other one is PRPTT. If the letter is a discharge letter, you have to use PRPDD. If it is a transfer letter, you have to use a PRPTT method. What is PRP? P stands for patient's name, full patient's name. Okay, then R stands for a single word, requires, and then P stands for purpose, because everybody knows that without purpose we cannot write the letter. The opening of the letter cannot be written. So the PRP and then DD. DD stands for discharge condition and discharge date. Now I am going to give an example for this one. Mr. Peter Parker, P, requires, or what does he require? What is the purpose? Since it is a discharge letter, further care and management at home. That's it. Mr. Peter Parker requires further care and management at home. This is one of the simplest examples for PRP DD model. So, Mr. Peter Parker requires what? Further care and management at home. A full stop. Then, as I told you, DD is remaining there. What is DD? Discharge condition and discharge date. He is recovering after pneumonia. He is recuperating after pneumonia and is being discharged today. Discharge. So you can write he is recuperating after any surgery name. You can write he is recuperating after angioplasty and is being discharged today and is being discharged tomorrow and is ready for discharge. These are some of the lines you can write. PRPDD. That's clear, I think. Apart from PRPDD, there is another one that is called PRPTT, but that is used only when it is a transfer. It can be emergency transfer. It can be non-emergency transfer. An example for this will be Mr. Peter Parker requires further assessment and management. See, whenever we transfer a patient, it is not for a home care, it is for further assessment and treatment, and the recipient of such letters, most of the transfer letters in such cases, recipients are doctors or such faculties. So Mr. Peter Parker requires urgent assessment and management. Okay, and then full stop. He has symptoms suggestive of myocardial infarction and is being transferred. Myocardial infarction being a very critical issue, you cannot wait for the doctor's permission or anybody's permission. You can directly send the patient via ambulance case. Then, if it is not an emergency case, Mr. Peter Parker requires further assessment and management. Full stop. He has suicidal ideation. He has suicidal ideation secondary to some kind of opium use or something you can write. So this is a PRPTT model. TT model is for transfer, DD model is for discharge. So once again, a closing of the opening paragraph with PRPTT is Mr. Peter Parker requires further assessment and management. Don't have to mention at your facility because it is understood. It will be only at their facility. Then after the full stop, the second sentence will be he has symptoms suggestive of myocardial infarction and is being transferred. When? Now. You don't have to write now and is being transferred. Or in non-emergency cases, he has recurrent episodes of vomiting and is ready for transfer. That is the difference between and is being transferred and is ready for transfer. Is being transferred is an emergency transfer and is ready for transfer is not an emergency transfer. For such letters, they will contact or they will schedule an appointment and they will give a date for the appointment. Date will be fixed and then the patient will be transferred. Maybe from the patient's home the patient can go, and or maybe from the hospital itself the patient can be transferred. This is the opening paragraph using PRPTD and PRPTT. Very interesting, and I think it is very easy for anybody to write any kind of letters that are existing in the medical scenario. Alright, so now we have done the launching part using DADR, don't forget. Opening part with PRPDD and PRPTT. Now it's time for us to go to the second, third, fourth and fifth paragraph of the letter. That means the main body we are going to complete. This area is known as narration area. Narration. We are going to narrate the letter starting from Mr. Parker was admitted on this particular date and he was diagnosed with this condition, or maybe you can also write something before that. X-ray revealed this one, and other further test, MRI, other things revealed this one, and he was diagnosed with this condition, and for this he was provided this kind of therapy, this treatment, and everything was provided. Did you notice that in the second paragraph everything is completely past tense? And once the past tense is over, you will start with the present and future tense. At present, Mr. Parker is able to tolerate light fluids and he can walk without assistance, and then say something about he smokes and drinks, and say something about his social part, something like he is, if it is required, write all those things and complete the letter. So there are two types of narration part, or second paragraph, third paragraph, fourth paragraph, and all the last paragraphs can be written using this method. What is that? One is V method and the other one is W method. I'm going to give more stress on the V method right now, and you will understand the W method also simultaneously. What is V method? V method is something very important because you have to follow this, otherwise you are not going to easily get a good score for writing OET letters. What is V method? As I told you, after the opening paragraph, you are going to the second, third, fourth, and fifth, and all those remaining paragraphs. In the second paragraph, most of the time, we start with the admission condition of the patient. Admission condition and admission date. Mr. Parker was admitted with extreme pain, the lower extremities, after a fall. He was an X-ray revealed that he had a fracture, for which he underwent this kind of a correction surgery. So you make sure that everything is written in the past tense. No present tense will be included in this area. That means, so once the past is over, you have to come to the present tense and go to the future tense. This is a V method. The problem is, or the benefit of this method is, once you enter here, which is present tense and future tense, you cannot write past tense in that area. So complete all the past tenses, and then once the past tense is over, you come to the present and then go to the future tense, something like this one. This is the best method for writing an OET letter. In most of the letters, you can use this one, the V structure of writing a letter. So what are you going to do? Mr. Parker was admitted with this condition, and he was diagnosed with this condition. He was given this medication, and this medication was commenced, and this medication was administered, and just say everything. And once you come to this last bottom area, this area, you are ready to go to the rising now. From here onwards, at present he is able to write everything at present, okay, and then go to the other areas like his social, his nutritional, his habits, and all the things, occupational things, and all those things should be included here. And once you reach here, you are going to take off the flight. I mean, you are going to start with the future tense now. It will be appreciated, it would be appreciated, completely future tense. So this is a V method for this one. But one more thing you have to understand is, in the V method or the second paragraph, you have to write only the medical part here, medical part, only the medicine administration, diagnosis, all the treatment, medication things should be mentioned here. Do not include anything social or anything here. Even if the letter is being written to a social worker, do not write the social one. Up to here, medical, M area. From here to here, emotional, like depression or something like that. Sometimes there will be only medical from here to here, no emotional. So, but in some cases you can see some kind of emotional also can be there. So medical, emotional, and from here you have to start with the patient's lifestyle, like he smokes and drinks and other things will be here, and his the occupational things, and then the nutrition part like diet, BMI, and all those things, and then write the social part. So MELONS, melons. This is the order of including the information also. You will have no confusion. Some people, they keep on writing the present part or the social history. He is married and he has 3 sons. In this area, what is used? This is the main area, which is a medical part, and this is the other area. So medical, If there is emotional, write emotional. Otherwise, completely medical, then write with lifestyle, including smoking, drinking, and any kind of drug abuse or something. And then occupational, what kind of job he is doing or he was doing. And then nutrition, his BMI, his diet, his diet modification, other things. Then social part. All right, I hope it is clear to you. Then write, it will be appreciated if you could take over the care of Mr. Parker and provide all those things. This area, remember, this area is also special for the discharge plan. In the case notes, you can see at the bottom of the case notes, you can see discharge plan or simply plan. In some cases, you will not see any plan that is so scary. So in using the plan area, you have to write the last paragraph of the letter. Kindly provide him that, kindly provide him this, kindly make sure that he doesn't drive. All the instructions should be given in the last one. And then close the letter. And then you can also write one more line. If you require any further information about Mr. Parker while he was under our care, kindly contact. Please try to avoid the old style like please do not hesitate to contact me. Nobody is going to hesitate when the patient is in a critical condition. Okay, so and also please stop writing that old style. I am writing this letter. Everybody knows that you are writing and you are writing, and this is a letter and this is to refer. Everything is understood because you have already written in the DADR line, DADR or RE line, that is a reference. So you don't have to repeat. OET doesn't like repetitions. So with this method, you will be able to write a letter wonderfully. So what is remaining? So we have done the launching part using DADR, opening part with PRPDD and PRPTT, the narration part with the V method and W method is also there. W method is just one difference with the W method is this one. So this area will be the only area, otherwise it is V only. Okay, but we are having one more past tense here. This is also past tense and this is also past tense. Here, what will be the past tense here? After writing all the whole thing here, you have to write at present Mr. Parker is able to walk without assistance, all the present medical condition, and then write, please note that he underwent angioplasty 2 years ago and his father died of this cancer. Okay, something like this one. This area will be one more past tense, that is the W model. Okay, first past, present, past, again present and future. This is a W model. Remember the V model the V model is for most of the cases, it is for discharge letters. W model is meant for transfer letters. Most of the cases, there are exceptions for that one. So with this, we have completed the narration part of the letter also. Now finally there is one more thing, that is the last one, that is closing of the letter or signing of the letter. Signing of the letter. All right, signing of the letter means you are going to write yours sincerely, charge nurse. Yours faithfully, charge nurse. Don't forget the comma after faithfully or yours, and do not put any apostrophe after, means in the yours. Some people write YOUR apostrophe S. There is no apostrophe S for yours. Y should be capital, but sincerely and faithfully is S and F should be small letter. A comma is mandatory there. How do we write sincerely and faithfully? That is the last thing I want to discuss here before this class is over. So the most important thing is, if you started with the patient's name, dear Dr. Sam, dear Mr. Martin, if you use the name of the patient in the beginning of the letter, that is a salutation area, then sincerely. If the name is not there, dear sir, dear madam, dear doctor, dear nurse, in all those cases, you have to write yours faithfully, comma, charge nurse. This is how we write a letter. This is known as the Melons method of writing a letter. Everywhere you can see Melons. In the further videos also, you will be able to understand the whole thing. There are almost 100 videos and you have to watch serial wise 1, 2, 3, 4, and this is a number 01. Okay, that is a first video. From here you can go to other areas, and reading, listening, everything is there, and you have to watch all of them. Please don't forget to subscribe so that you will be getting notifications about the newer videos.